Dr. Cowden of the veterinarian world, and her testimonies that she's going to share with you, and her success with using this tool along with many of the other tools are just phenomenal. So here she is.
And I got a mic.
Oh, you are awesome. How'd you do that?
Okay, how long should a cat live for? Somebody make a wild guess. World Guinness Book of Records, 38 years and 3 days. And they had a housemate that lived to be 34, owned by a plumber in Texas. I would venture to say that Cream Puff probably lived outside a lot of her life and probably ate a species-appropriate diet, which got her to that lifespan. This is Maggie. Maggie lived to be 30 years, and her owner attributes her longevity to the fact that she did high-intensity exercise every day. She ate a raw diet of placenta and raw cow's milk, and she did intermittent fasting on her own. She lived on a dairy farm. So I think it's pretty clear that we're not suffering from a deficiency of pharmaceuticals. Everybody agree? Okay. We have a pill for every ill in the veterinary industry, and we have a diet for every disease. And despite that, we're still seeing cancer rates of dogs 1 out of 1.65. That is almost 100% of dogs. They have the highest rate of cancer of any mammal on the planet today. Cats are right behind them at 1 out of 3. And this is age irrelevant. I'm diagnosing cancer in dogs under 2 years of age. You know the KISS principle? Keep it simple. I'm not hearing anybody. Keep it simple, stupid. But stupid doesn't work for me, and it doesn't work in nature. So I've reframed that to be keep it simple and sustainable. Because what is sustainable is successful. So I model most of what I do after how nature does what they do, which is a lot better than what man does. So what if we are missing the elephant in the room? Sometimes even if I stand in the middle of the room, no one sees me. And isn't that really true? We've been taught as practitioners to name it, then we blame it, then we give it a pharmaceutical, or we nuke it, or we cut it out. But what if instead we were able to look at the biology of the body, actually work with how the body was innately designed, and let the innate intelligence of the body do its job? Sound good to you? Okay, you guys are not really excited. This is really cool stuff, so I need you to be excited. And when you get excited, your lymph is going to move better. So this is really good for you. This is my 6-step principle for how I treat disease. Number 1, we stop polluting the body in all aspects that we can control. Number 2, we supply all the essential nutrients the body needs to do its job. Number 3, we heal the gut. Number 4, detoxification of all 6 organs of elimination, which includes the lymphatics. And then we work on mitochondrial repair and regeneration. For today's lecture, we're going to be focused on just the lymphatics in that form of detoxification. Lymphatics in dogs are very similar as it is in people, and I found Dr. Gramuth last year here, and I knew there was a missing link in my practice. With all the things I was doing, I wasn't really affecting the lymphatics well. We have a V-probe vibrational plate that we put our patients on, but it really wasn't enough, and the manual therapy on them wasn't enough. So we have started to see some magic. Is that social proof that our fur babies are really important in our lives? And it's interesting to me that people will do more for their pets than they will for themselves. True, everybody's nodding their head. So this is Popcorn. Popcorn came to me with a long history of his entire life having GI problems, bad appetite, vomiting all the time, intermittent diarrhea. We used our 6 principles. We got him a lot better, but there was still a missing link. So now we're down to only once or twice a year having a problem, but he presents for vomiting, not eating, and an acute episode of diarrhea. So now I have my lymphatic therapy machine. So we thought, okay, we're going to go ahead and treat Popcorn. So here I am just doing his lymphatic therapy, and he is not being held there. He is really enjoying me doing this therapy. This is his live blood. Since Dr. Gramuth showed us a lot of thermography, I thought I would do live blood instead. And if you look on the left, that is how his blood looked on presentation. He had rouleau, his cells were not nice and round. If you guys are familiar with Dr. Pollack's work in the 4th phase of water. We know that when the cells are clumped up like that, they're not going to work as well. On the right is popcorn immediately following lymphatic therapy. I should hear some wows, right? I mean, that's amazing difference in blood. And I did nothing else except lymphatic therapy. Would you take a white dog that was a model and put them in an ion bath? And he came out yellow, but it did wash off. And he did fantastic. He has not had a relapse in over a year. But we try to get people to do things on a preventative basis because at the end of the day, isn't it better to prevent disease than to have to treat it? So this is Lola. If you would like to follow Lola, she has her own Instagram page. She is quite famous. And her mom gets lymphatic therapy with the same type of equipment. So of course she had to bring Lola in. So here Lola is getting her therapy. I think Lola is enjoying her lymphatic therapy. Mommy got hers done last month by the same machine, and now it's Lola's turn, and she is quite enjoying it. Look at her laying there, just relaxed. Lola's enjoying it. So what does it offer us? We know that we're boosting the immune system. We just heard all about that. We know it's doing detoxification. And we have great compliance with our animals. They actually really like it. Even cats. And cats don't like very many things that we do in our office. But cats enjoy this, and we try to make it part of their wellness program. So several times a year, we have a wellness program that includes lymphatic therapy. These are not cats that are going out doing high-intensity exercise, so we have to figure it out some other way. And this is a wonderful way to be able to get those therapies in. So I'm going to present a couple cases now. This is Hope. Hope was lit on fire and burned over 80% of her body by an abusive owner. She was rescued, and they were able to actually save her life. If you notice, she doesn't have any ears, and she doesn't have any hair on her body, and most of her body was covered in scars. So when she came in, she had been, over the past 4 years, been treated by a variety of allopathic therapies, and she was doing okay until she developed rheumatoid arthritis, spiked a high fever, and then from that point on, they kept adding more drugs and more drugs with every symptom, and the owner realized they were destroying this dog's gut, and she, on her own, decided she needed to do something else. They had to carry Hope in because she was not willing to walk. She was so painful, and she wasn't eating. So we did her lymphatic therapy that day. We did a chiropractic adjustment. She had a lot of degenerative disc disease going on. And I don't have a video of it because we were all crying at the end and no one grabbed their camera. But Hope got up out of that trough and started walking around the office. Then she started trotting around the office and she started eating raw food out of my hand. So we were all really happy. She continued to come in and she's doing fantastic now. This is Moose. Moose had a lifelong history of chronic skin problems, and we had gone through our whole 6-step formula, but she was still having intermittent episodes, which meant something still was not right in her body. So this is her on the left, right before we did lymphatic therapy, all red, crusty, really inflamed, very itchy, unhappy dog. And then 2 days later, that is her on the right. And she doesn't have normal skin, but you can see there is a dramatic improvement in her skin. I'm going to show you a variety of different things so we can see how much lymphatic therapy plays a role in all of our cases. This is Rudy. Rudy had ruptured his cruciate ligaments and was not able to use his right leg at all. And this had gone on for months before I met him. So we put him on our protocol. We did lymphatic therapy, we did PRP and prolozone injections, and this is him walking immediately following his prolozone injections. And did it last? Here he is a week later, walking even better, and he is still using his leg, and he hadn't used his legs for months. This is Chikari. Squamous cell carcinoma was diagnosed at a referral center. By the way, most of my cases come from a referral center where the owners were told, I'm sorry, there's nothing more that can be done. So we do something else. So this is her coming in with the squamous cell in her nose. She went through our whole protocol. This is her getting her sauna, and she's getting her ion foot bath. We got lymphatic therapy. She's getting IV photobiomodulation. She came in twice a week. Of course, did all the nutritional changes as well. This is her in May and then June on the other picture. And then this is her live blood. So we can see when she started out that she was all sticky. And then by June, her cells are starting to look a whole lot better. And here she is in July, and we're seeing a regression of the tumor. We don't actually see any cancer in there, and we are now out into November. She has no evidence of cancer in her nose at this time. This case was really important to me because Red Rover came in, he had lymphoma, and he was also diagnosed with metastatic melanoma to his lungs. He wasn't eating, he wasn't moving around, he didn't feel good, he was grossly overweight. So we started our protocol on him. He was still being seen by a referral center. After 1 week, he starts losing weight, he's eating, he's feeling better. The owner reports he's acting like a puppy. She's really excited. And then at the 4-week mark, which is not long enough, they decide they're gonna go back to the specialist and they wanna take another chest radiograph and see how he's doing. Now, we've already documented it takes about 10 weeks at minimum to really see big changes. And they decided that they were just gonna see where we were going. They went to the specialist and the specialist said, oh, it's not any better. And they convinced the owner to stop therapy. Moral of the story, do not treat and diagnose just based on your lab works. Look at your patient and see how they're doing, because all of these guys get better. And sometimes really our objective is quality of life. At the end of the day, we're all leaving the planet. But can we stay here and have quality of life while we're here? That's our number one objective. So this is a dog that came in, had chronic history of skin problems, presented for ataxia, had already been to a referral center. They were already working with the dog. They were telling the owner there was nothing more that could be done. I backed up and I said, you know, this dog has had a long history of inflammation in every aspect of her body. So we decided we were going to treat the inflammation and not even worry about the ears. So this is a list of the things that we did. Because of time, I'm going to go really quickly. This is the dog immediately following the first therapy. You can see his head starting to get a little more straight. And this is his live blood. Again, really cruddy looking blood when we start, dramatically better. Can I hear a wow? All right, got to keep you guys excited. So there he is looking tremendously better, and that's after literally just a couple of days. And then this is him following 3 therapies, approximately 12 days apart. He is normal, and the owner was thrilled because his skin had cleared up. Go figure, right? This is little Luna. She came in right after Christmas, and the owner didn't know what happened. She was suddenly profusely drooling, and there was a pile of poo on the floor, which was uncharacteristic, so she didn't know what had happened. And I opened this dog's mouth, and I see this burn all the way across the tongue. And I want you to appreciate how far back that burn is. Here's the tip of her tongue, and there's her canine teeth. Look how far back that burn is. If she lost her tongue, there really is nothing more you can do because she can't eat and drink. So it was really important for us to try to get this dog to heal. She was on hourly treatments of silver, of Lumiped or Ion, which they're here, and we were doing laser therapy. We did lymphatic therapy on her. And here she is getting her little lymphatic therapy. Now you got to imagine how painful that is. That's your tongue. She was eating in 24 hours, and in 7 days, she was fully healed, and she saved her tongue. That was pretty cool, guys. Come on. All right. She appreciates your applause. This is Bobby. Bobby came in. He has AIDS, and he was suffering from really chronic sinus infections. When I tell you there was snot coming out of this cat's nose, I am not kidding. It was hunkers coming out. And she'd already been to other veterinarians. They had put him on antibiotic after antibiotic after antibiotic. He wasn't getting better. So we backed up. We did our protocol. You can just see the amount of snot coming out of this cat's nose. And so here he is getting a salt therapy. And all of his snot went away. But in April, he started coughing. And we did some radiographs and found that he has now developed a lung tumor. It's actually there. In the translation, our slides got off. So he has a lung tumor. That was back in April. We are now in November. He still has no snot. He is not coughing anymore, and he has great quality of life. Yeah, that's what we like to hear. They appreciate that. There he is. I mean, he's a cool cat. Meaner than snot. Pun intended. So most of the time when I work on Bobby, he's sleeping. because he will bite me. All right, Chunky I don't have a picture of. I didn't get it in time. But Chunky was a 2-year-old male neutered cat who was itching, and the owner took it to his veterinarian, and the veterinarian decided to napalm the cat and gave him a steroid injection. 2 days later, he went into heart failure. So the owner is at a referral center. He's working with the cardiologist. The cat was stable but not getting better. Wasn't reversing the heart disease. So the owner said, well, I think I'm going to go to Dr. Siegel, and I want to see if any alternative therapies help. And of course, the doctor knows me, and he rolls his eyes, and he goes, well, if you want to do that quackery, whatever. And so the owner came in, and in 2 treatments, this cat improved over 50% of his cardiac function. And the cardiologist had nothing more to say. Okay, so there his live blood when we started, and there he is immediately following his first therapies. So he had pulse electromagnetic frequencies, he had lymphatic therapy. Owner didn't have a lot of money, so we were kind of limited on the things we did. And he is back to playing like a normal cat. He's only 2 years old, and he has great quality of life. This is Tucker. Tucker was the first patient we did lymphatic therapy on. 2-year-old Great Pyrenees, came in from a referral from another veterinarian, lameness, swelling, and he had osteosarcoma in his leg. So you can see the swelling. He was non-weight bearing, not a good thing when you weigh 140 pounds. He was grossly overweight. The owner has a rescue kind of on their own. I think they have like 16 animals, and they put all their dogs on a raw diet. That's a feat in itself. And here he is getting his IV photobiomodulation. He went through everything. Here he is starting to heal, and the lesion is actually filled in. Within a month, he was weight bearing. All the swelling was gone. All the pain was gone. He's acting like a puppy. He's losing weight. And we had a board certified radiologist read the post films as well as the pre films. And he said, either he didn't have an aggressive form of osteosarcoma. I didn't know there were non-aggressive forms, or your therapy is working. We took the second one. This is Abby. Abby came to us because several veterinarians could not diagnose her. She looked that sick when she came in. She was under 6 months of age, and she turned out that she had a liver shunt. So once we diagnosed a liver shunt, we sent her to the University of Florida to see whether or not she was a surgical candidate, and they found that she did not even have a portal vein. So she was not a surgical candidate. They gave the owner a very poor prognosis. They said she's never going to thrive, she's never going to do well, and consider euthanasia. This is Abby 2 years later. And she's almost 3 now. And she is the cutest little thing, and she will roll over and give you her belly.
Roll over. There she goes.
Never say never. This is her before and after picture with her mummies. And this is another liver shunt. They just happen to both come in the same day. They're not related. But my liver shunt cases are doing fantastic. This is Daisy. Daisy came in to an emergency clinic. I was out of town, and she was paralyzed. The emergency clinic said because she had a mast cell tumor and she was old, that they should just euthanize. They weren't willing to do that. They came in Monday morning when I got back, and this is Abby starting to stand, and here she is walking.
All right.
And that was 4 days. And thank you. Same referral center where little Kim came from. They told this owner that she would only be able to walk again if she had surgery. They didn't have the money for that. 4 months went by before they found me. And I'll cut to the chase. Here she is standing in a matter of 4 days. And this is her in 14 days. She was actually walking before that, but the owner didn't give me the video until the 14th day.
Esta niña cree que está bien.
Told she would never be walking again. Thank you. Wow, I did it with 1:55 to go. So there is one more slide here. If anybody would like to stay connected, the veterinary world very much wants to embrace the human side of our natural medicine world, so we would love to stay connected. And when somebody tells you or someone you love or someone you know that there's nothing more that can be done, just let them know that there's always something more that can be done. Thank you. I I think we have time for Q&A.
I was talking to a person who actually has made some of these devices, and they were saying that it wasn't good for a person to use it repeatedly over time, but this isn't quite what I'm seeing here. So are there any contraindications of how much you use it?
Yes, yeah, because it's just with any type of detox tool, you don't want to detox constantly. You want to detox, rest, and detox some more. So I would not recommend, and there's been only a few cases where we have done back-to-back sessions and still had great results, but there's not been enough research on that. And that was really with like Lyme, Lou Gehrig's, and Parkinson's patients. And we had great success with it. But with, just in general, you just don't want to constantly be detoxing the body without supporting it. So that would be the thing that I would say. What about you?
What I've noticed in our fur babies is that when we start to really treat these animals with chronic illnesses, we have to get those organs of elimination open in all of them. Yeah. And if we don't do that, then they do tend to start losing their appetite. They don't feel good. They start getting achy. So we really work on that opening of all the organs of detoxification first. And of course, then I go through that sixth principle. You can't fix something that you're still lighting fires on. So they have to get on a species-appropriate diet. That was the reason I actually went and made my own species-appropriate diet, because I couldn't find anything out in the market that was sufficient.
What was the root cause of the last two dogs that couldn't walk?
The degenerative disc disease, inflammation. So they were all on processed foods. They're eating all these chemicals.
Turned it around in 4 days?
4 days. Most of our paralyzed dogs are going to be walking in 4 days up to 14 days. There's only been 2 cases that I haven't been able to get to walk. And that's I've been doing this over 20 years. Mm-hmm. I've been practicing for 37 years, but I started when I was 5, so if you're doing the math. Disclaimer. Or I could say I'm 90 and I do lymphatic therapy every week.
And she looks this great.
Very good question, and thank you for asking that. The question was, do you have to be a vet to offer this therapy? It is illegal, at least in Florida, to practice veterinary medicine, do therapies on an animal without a veterinarian prescription. So if you want to work with animals, then cover yourself, make sure you find a veterinarian who will examine that animal and say they need this therapy from you. And that's true for chiropractic, massage, everything.
Okay, so if you have any questions about how to implement this, again, just go to the booth. What booth number are we?